Yeah, this is the most welcome step. I think for a long time the industry has been asking for rationalization of GST rates for various medicines and devices. So this is going to be extremely helpful for reducing the prices for important drugs, especially cancer drugs, and some of the high-end devices which are very expensive. Those also the rates have been reduced significantly. So far we haven't heard about it, but that has been again a long-term demand because, as you know, that there is a lot of gap between demand and supply of number of beds in the country, especially in tier 2, tier 3 cities, and some of the geographies are very underserved, like Bihar, for example. So those areas require more infrastructure, and if the industry is given infrastructure status, that is going to be helpful in raising funds and bringing in more capital to grow those facilities. So this has been a long outstanding demand, and I'm sure the policymakers will look at it favorably. So there has been a lot of issues of lately, and this has been part of the press. But my personal view is that health providers and insurers both have an equally important role in the ecosystem of healthcare. And I think active collaboration is important. Both the industries are very, very important. Now, the new GST rules, as you spoke about earlier, have eliminated the GST on health insurance premiums. So that is going to reduce the healthcare insurance premiums by at least 11 to 12%. Because there are some certain costs which are associated with the company, so which they may not be able to pass on, but at least that much reduction will happen. So I think that is an important element. Now, it is important that the health insurance companies understand the concerns of the hospitals. There are issues where rates are not revised for a significant period of time. There are issues about the receivables, deductions which are sometimes unreasonable. The amount of time which it takes for approvals is sometimes very long, and which takes long time to discharge the patients. So these have been some of the outstanding issues. But I don't think these issues should become a matter of confrontation. I strongly believe that these are two strong pillars of the healthcare ecosystem, and they have to work together. I think collaboration, discussion is important, and that is what is going to find solution to these problems. Yeah, so these public schemes like Ayushman Bharat have decided the rates which are very low, and those rates sometimes are not sustainable for private sector, and there are issues about long-standing payments. Receivables from the authorities, and that creates further problems on the cash flows of the hospitals. So with all these problems, this scheme currently has been a little difficult for private sector to be able to deliver on. Yeah, so as far as hospital pricing is concerned, there is a transparency. Now, if the insurance companies say that there is a difference in the pricing of one company versus the other, that is a fact. And that is a result of the negotiations which these insurance companies have directly with the hospitals. And they have been having that for years. So as far as transparency is concerned, it is already there. The Clinical Establishment Act, which has already been implemented in many of the states, mandates that the hospitals provide their rates in the open. They demonstrate it somewhere on a public board or something within their premises. So that part is already there. I believe that National Health Exchange, where as far as it is concerned, it is going to do nothing for the pricing. Of course, it is important because it is going to ease out the process of claims. So definitely I am all for the involvement of the Common Health Exchange. That is a helpful mode. But that doesn't mean that the prices are going to be uniform or the prices are going to get regulated through that. Yeah, so healthcare needs to be delivered as close to a patient as possible. So where people are, the healthcare should be there. So secondary care, especially, tertiary care, which is occasionally patients access, could be in the larger cities, but secondary care has to be available at their doorsteps. So that is very, very important part. And as I said earlier, many parts of the country have very deficient infrastructure. So I think there has to be a focus on that. Currently, there are certain challenges in these areas, especially on human resources. Nurses and good clinicians in the secondary towns and tertiary towns is a difficult proposition. So I think a lot of reforms are required in medical education, paramedical and nursing education as well, in order to bridge that gap. The easiest part is to create a hospital in these areas, but the most difficult part is to staff it. Yeah, so public-private partnership is the need of an hour. There are many examples, especially in dialysis and in the diagnostic imaging services, laboratory services. There are many examples where several states have done these projects very successfully. So I think that model should be explored further. Currently, these models have a lot of shortcomings which need to be reviewed, and I think the government also needs to do a proper evaluation as to what works and what doesn't. Yeah, no, this is a private partnership. It is not a public-private partnership. We are not. It is not a preferred mode for us to do O&Ms. We would like to have the infrastructure under our control, and we would like to own the profit and loss of a facility. So, but in some of the new geographies where we are not present at the moment and we have not created a cluster, there we are open to exploring such opportunities. But other than that, our primary way of growth would be acquisition or a greenfield hospital or a brownfield expansion. Yeah, so the medical value travel is something which is going to continue for quite some time, especially for tertiary, quaternary kind of care. Primary and secondary care is not going to be something where the medical tourism is going to play an important role. India has a unique position because our costs are low. The irony is that when the insurance companies or some of the public perception is that the Indian healthcare costs are going up very rapidly. Whereas on the other side, we keep on discussing about the medical tourism and why they come here, and they come here for value because the Indian costs are low and the quality is high. So the discussion should be about quality, and international patients will continue to come to for our services because they're economically priced and they're of high quality.